Hello everyone. We'll be continuing our revision of the theories in child development. Okay, so in the previous section, I had covered the psychoanalytical or psychosexual theory, that is Freud's theory. Today we'll be discussing the two important psycho social theory and the cognitive theory. Okay, so psychosocial theory, also called as theory of developmental task, was given by Erik Erikson, okay, in 1963. So Erikson basically extended Freud's theories in three different ways. Okay, Freud had emphasized uh, childhood, and he proposed that personalities shaped approximately at age 5, whereas Erikson suggested that the development of the personality continues throughout lifetime. Okay, so he elaborated on all those stages and laid a greater emphasis on ego than on id, unlike Freud's theory, and he recognized the impact on personality of the cultural and historic forces as well. His is also known as the epigenetic principle of maturation, that development depends upon genetic factors as well, and the idea that human development is governed by a sequence of stages, okay, which depend on the hereditary and the genetic factors. Okay, so in his theory, he gave two important terminologies, the crisis and the basic strength. Okay, he said that at each and every stage, there is a confrontation with the environment, which is known as crisis. Okay, in Erickson's theory, human development involves a series of personal conflicts, to which he referred to as crisis. And he said that, to that crisis, any individual can react either in a maladaptive way, that is a negative way, or in an adaptive or a positive way. So only when we have resolved each conflict can the personality continue its normal developmental sequence and acquire the strength to confront the next stage crisis. Okay, so only once the crisis is resolved, then the person goes to the next level of the personality, and this is how a developmental sequence takes place. Okay, so it is the conflict at any stage that remains. If it remains unresolved, then that particular person is you know less likely to be able to adapt to new problems during the later stage. Okay, so once the crisis is resolved, then the person acquires basic strength. Okay, he suggested that the motivating characteristic and beliefs that are derived from the satisfactory resolution of crisis leads to development of this basic strength. Okay, so one strength cannot develop until the strength which is associated with the previous stage has been confirmed. Okay, so the first one is the oral sensory stage, which is 0 to 1 year. Okay, here the newborn's first awareness is of the physical needs, most importantly the need for nourishment, and if the parents or the caretakers they take care of those needs consistently, the infant needs to learns to trust others. Okay, so he develops the feeling of trust. Confidence develops, basic trust is established, but that's still not permanent. Okay, so the basic strength which one gains during this stage is trust. So the crisis here is trust versus mistrust. Okay, the positive outcome, if the nourishment needs are met consistently and responsibly by the parents, then the infant not only will develop a secure attachment, but will also try to trust the people in the environment in general as well. And the negative outcome is that early deprivation of physical and psychological needs leads to a devastating child's personality. Okay, dental application during these stages, that separation anxiety exists in the child. Okay, so if the dental treatment has to be done or consultation has to be done, then the child's parent or the mother should be present at the operatory. Okay, Here you have to take care of patient positioning. Many young children, they find the large chair very threatening. Okay, so as a rule, infants and toddlers, they are rarely placed in the dental chair by themselves. Okay, they are usually put into a mother's lap or into any of the parents' lap. Okay, so instead of the chair directly. Okay. Then comes the second stage, which is muscular anal stage, 1 to 2 years. Here, crisis is autonomy versus doubt. Okay, so by the second year of life, all the muscular and nervous systems, they have developed markedly, and the child is now eager to acquire new skills. Okay, so the critical issue is that child now starts feeling independent. Okay, they learn to communicate more effectively, to walk, to climb, push, pull, hold objects. Okay, they take pride in these skills and usually want to do as much as possible by themselves. Okay, anal region is the focus of this stage because of toilet training crisis. Okay, the positive outcome is if parents encourage their child this initiative and reassure when they make mistake, the child will develop confidence, okay, which is needed to cope up with the future situations where he would be required to, choose or control all those things. And negative outcome is in an extremely pessimistic environment, the child encounters difficulties and then can become overwhelmed and might doubt himself and not may not develop a sense of independence. Okay, so similarly, if the control is too severe, the child feels worthless and shameful of being capable of so little. Okay. The rental application is now child is moving away from the mother but will still retreat to her in threatening situations. So parents' presence is very important. Then dentist must obtain cooperation from him by making him believe that the treatment is their choice, not that of the dentist. Okay. So we can ask the parent to be an observer, and loud noises might frighten them. We have to use short acting local anesthesias. Okay, all those are the applications. Then we have to simplify the procedure. For example, if we are extracting anterior tooth, then after giving a LA, we should try to check the effect of local anesthesia with the beak of the forceps itself rather than using two different instruments. Okay, so also to temporize the treatment if it's necessary. Okay, like instead of doing pulse therapy directly, if we can delay it by using some preventive measures, so all those things should be done. Then comes the third stage, which is early childhood, locomotor genital stage. Children develop motor skills, they become more engaged in the social interaction with people around them. They must now learn to achieve balance between eagerness for more adventure and responsibility. Okay. Then here the crisis is initiative versus guilt. The positive outcome is that if parents are encouraging, the child will learn to accept without guilt that certain things are not allowed, and at the same time will not feel shame when using their own imagination or engaging in role play. Whereas negative outcome is that if they do not respond well to the child's capabilities, then the child might develop a sense of guilt and may come to believe that it's very wrong to be independent. Okay, so dental application is for most of the children, the first visit to the dentist comes during this stage. Okay, so going to the dentist can be considered a new and challenging adventure in which the child can experience success. So usually just keep it as an exploratory visit. Okay, with little work, you can examine the child, you can take a radiograph if required, but not more than that. Okay, so that's a good way to start the dental treatment. Okay, because the child at this stage will be intensely curious about where the child has come, why he's come over there, so all those things. So you have to keep it like an exploratory visit. So young children, they have to be led through the procedures slowly, step by step. Okay, then you have to state the general goal to the child at the outset. For example, I have to fix your tooth, okay, or to make your sick tooth better, like that. Explain the necessity for the procedure. Child who understands during this stage Okay, you have to explain it to the child. For example, you have to tell the child that this is being done to make your teeth healthy, or or your teeth strong so that you can eat. Okay, so your tooth doesn't get worse or hurt you. Okay, so that you will look nice. So you have to use those simple terms to explain the procedure. Divide that procedural explanation. Use euphemisms. Euphemisms are nothing but alternate substitutes of words which are used, okay, which can better help the child understand. Okay, reinforce appropriate behavior. If the child is behaving well, then give some positive reinforcement. Disregard any kind of minor inappropriate behavior, all those things. Then comes the stage 4, which is latency stage. It's 6 to 12 years. Here the crisis is industry versus inferiority. School is an important event during this stage. In Erickson's term, the child acquires industriousness, okay, and begins the preparation for entrance into a competitive world. So the influence of the parents as role models now decreases, and the influence of the peer group increases during this stage. Okay, they learn to make things, to use tools, they acquire new skills. Okay, all those things happen during this latency stage. The positive outcome is that the basic strength which a child gains, they can discover pleasure in intellectual stimulation, being productive, seeking success. Okay, they develop a sense of competition. Whereas negative outcome is if the child is not allowed, then maybe due to harsh teachers or rejecting peers, then the child develops a sense of inferiority and a sense of inability to compete. Okay. Dental application. Children at this stage, they still are not likely to be motivated by abstract concepts. Okay, you cannot explain them the concept of better occlusion, all those things. Rather, they can be motivated by improved acceptance or status from the peer group. For example, emphasizing how the teeth will look better as the child cooperates is more likely to be a motivating factor than emphasizing that the importance of a better occlusion to such children at during this stage. Okay, then there is an important terminology which is called problem ownership. Okay, giving orders to the child during this stage that you must sit still or you must stop crying, these are not accepted well by children during this stage. Okay, these messages tell children that they have no control over the situation no matter what they're feeling. So most of the people, that is children during this stage, do not like what do not like to be told what to do. So these you messages should be avoided and I statements should be used. Okay, use more and more of I statements. Like an alternative to this is, I can't fix your teeth if you don't keep your mouth wide open, or if it would take me a bit longer to fix your teeth if you keep moving about. Okay, so here it's an I sentence now, I statement. The dentist is referring to himself that or herself that I can't do this if you don't sit still. So instead of you sentences, use I sentences. This is called the concept of problem ownership. They don't like to be told what to do during this stage. Okay. So listening is important in treatment of all the children, more so in older children. So children, they are eager to learn, they're susceptible to developing new habits. When habits are developed at young age, they are likely to continue throughout life. Okay, like if a child named Anshu has a digit sucking habit, thumb sucking habit, it might be helpful to say that Anshu, you are a big boy now. Only little children sometimes suck their fingers and I can help you to stop. Okay, so this is how you're supposed to convey it to the child. The importance of explanation to a child should never be underestimated. Intervention by the health professional for 5 minutes can sometimes do more than what parental discussions over a period of weeks might do. For example, when children come home from school, they often refer, the teacher said this. So though it is the same thing the parent has been saying uh, for so long, but the child listens attentively to the teacher or any authority figure. So for the child, the dentist is also an authority figure. Okay, so you have to uh, know that this is the importance of explanation. If you tell the child to brush twice daily, that would cause much more effect than a parent telling it to the child. Then comes stage 5, which is adolescent stage, 12 to 18 years of age. Okay, in the teens, the focus shifts from parents to peers now. Friends have influence. There is a change which is brought about by rapid physiological development is taking place. There is, hormonal secretions are at its peak. These development occur for the first time or in much greater amounts than previously. And these developments occur on an average about 2 years earlier in females. Okay. Here, crisis identity versus role confusion. Formal operational thinking now begins to play a role for adolescents, and the sense of identity includes both feeling of belonging to a larger group and realization that one can exist outside the family also. Positive outcome or the basic strength is that if adolescent solves this conflict successfully, then he'll come out as a strong identity and will be ready to plan the future. Whereas if not, then the adolescent will sink into confusion, is unable to make any decisions or any choices, especially about vocation, sexual orientation, any role in his life in general. Okay, so this in turn can lead to a poor sense of direction for the future, confusion regarding one's place in the society, and low self-esteem. Okay, the dental application is behavior management of adolescents can be challenging. So treatment should be carried out if the adolescent wants it, not the parents. Okay, now, so as at this stage, parental authority is being rejected by the children. Okay, approval of peer group is extremely important. They grasp abstract concepts also now readily during this stage. Then comes young adulthood, 19 to 40 years. Here, these new responsibilities of early adulthood, according to Eric Erikson, can create tensions and frustrations. Okay, and also one solution involves intimate relationship with someone, physical or psychological. So this relationship can provide some form of relief from the strain of work and family. Okay, crisis, intimacy versus isolation. So, no matter how successful you are with your work, said Erickson, you are not developmentally complete until you are capable of intimacy. Okay, in this stage, the most important events are love relationships. Successful development of intimacy depends on a willingness to compromise and even sacrifice to maintain a relationship. So, an individual who has not developed a sense of intimacy may retreat to isolation. Positive outcome, adult individuals can form close relationship, share with others if they have achieved a sense of identity, whereas if not, they'll fear commitment, they might feel isolated and are unable to depend on anybody. Okay. Dental application at this stage is external appearance is very important. है ना? So it helps in attainment of intimate relationship. Therefore, then comes the stage 7, which is middle adulthood, 40 to 65 years of age. Okay, the crisis is generativity versus stagnation. The next generation is guided in short not only by nurturing and influencing one's own children but also by supporting network of social services. Oh, okay, so they like to socialize now, and the opposite personality trait in adults is stagnation characterized by self-indulgence, self-centeredness. Okay, so the crisis requires expanding one's interest beyond oneself to include the next generation. Positive outcome is people can solve this crisis by having and nurturing children or helping the next generation in other ways. And negative is the person will become self-centered and experiences stagnation later in life. Then comes stage 8, which is last stage, late adulthood, that is 65 years to death. So crisis here is integrity versus despair. The term integrity implies emotional integration. Okay, in elderly we see there is a completion of the life cycle taking place. So their infirmities remind us of the young, and as they become more and more limited, the earlier issues of industry, initiative, autonomy, even trust arise again during this stage. Okay. The positive outcome is if the other seven psychosocial crises have been successfully resolved, then the mature adult now develops a peak of adjustment. Okay. Whereas if the adult has not achieved all that, then negative outcome is despair. Okay, this is often expressed as disgust and unhappiness on a broad scale. Okay, also it is accompanied by a fear of death which will occur before any kind of change that might lead to integrity can be accomplished. So to summarize, these are the stages: oral sensory, which is birth to 1 year, trust versus mistrust. Okay, then muscular anal stage 1 to 3 years, autonomy versus doubt or shame. Locomotor genital stage 3 to 5 years, initiative versus guilt. Latency stage 6 to 11 years, industriousness versus inferiority. Adolescence 12 to 18 years, identity versus role confusion. Young adulthood 18 to 35 years, intimacy versus isolation. Adulthood, generativity versus stagnation. And then maturity to old age, ego integrity versus despair. Okay. Now comes the second theory, which is cognitive theory by Jean Piaget, which was given in 1952. It is one of the most important theories of development. Okay, so Piaget, he was leading in Geneva School of Psychology, and his concept was based on genetics. He studied genetic epistemology and developed the most detailed and comprehensive theory of cognitive development. Okay, so development of knowledge is a form of adaptation according to him, and it involves the role of two main forces, which are accommodation and assimilation. Okay, then he in his theory has used several terminologies which I'll be describing so that it's easier to understand. Okay, so one is operation. Any kind of action which the child performs mentally is called operation. Okay, then comes schema. Schema is a dynamic process of differentiation and reorganization of knowledge with resultant evolution of behavior and cognitive function. Okay, then comes assimilation, which is a process of taking in new information to previously existing schemas. I'll give you a small example. Like if a child who has just learned the word bird will tend to assimilate that all flying objects are birds. Okay, so even if he sees a bee the next time, the child will say, look, that's a bird. Okay, so that is a schema that the child thinks all the flying objects are birds. But now let's suppose the mother tells the child the next time he sees a bee that it's not a bird, it's a bee, it's an insect. Okay, so now there is a process of that taking in new information. The child takes that new information. Okay, this is a smaller insect. It is not like bird, which is much larger. Okay, so that process of taking in the new information to the previously existing schema is called as assimilation. Then comes accommodation, that is modifying oneself so as to fit in with the existing characteristics of the environment, that is altering the existing schemas or ideas. The child might be knowing something, but now he knows that that is not correct. Okay, so that altering the existing schema or the ideas. Like here in this picture, we can see a girl is holding a banana like a phone. Kids often do that. They hold any object which resembles a cell phone and then they try to, you know, make a phone call. But as the child grows, the child learns that this is not a phone, this is some other object, this is a banana, and you're supposed to eat it. So this is modifying oneself to fit into the existing characteristic. Okay, so this is altering existing schemas or ideas. Then comes an important term, equilibration. Equilibration is a tendency of an individual to fill in all the gaps in knowledge by reconstructing the beliefs when they fail to test out against reality. Okay, so this is basically a balance which is maintained between the previous knowledge, that is assimilation, and the new knowledge, that is accommodation. Okay, now let's see Piaget's stages. Okay, so according to Piaget, the uh, development can be divided into these four main broad stages: the pre-verbal sensory motor period, which is 0 to 2 years. Okay, then the pre-operational period from 2 to 7 years, which is further subdivided into pre-conceptual stage 2 to 4 years, and intuitive stage, which is 4 to 7 years. The period of concrete operations 7 to 11 years, and the period of formal operations 11 years and beyond that. Okay, the sensorimotor stage, the first 2 years, 0 to 2 years, and during infancy, here there is an important term called object permanence or constancy. Okay, the child doesn't know that the object is permanent or not. Here in this picture you can see there's an infant and there's a toy which is placed in front of him. So he sees this elephant toy, and when somebody blocks his vision and places a paper or a card, the child doesn't know that the elephant is still there. Okay, so the child does not know that it's constant, or the object permanence is still not there. Okay, infants tend to attain this with respect to people before they do that with respect to inanimate objects. Okay, especially they tend to attain it with respect to their mothers, um, before they do it with any other person. Then comes animism. It is imparting life to inanimate objects like any kind of furniture, wall, floor. If the child gets hurt, you must have seen that, child feels happy if somebody hits them or if the caretaker hits them. The dental application, very simple. Child begins to interact with the environment. Now the child can be given any toys to play while sitting on the dental chair. So this first stage is further subdivided into reflexive stage 0 to 2 months. Okay, neonatal reflexes are there. There are uncoordinated movements. Then the primary circular reactions take place 2 to 5 months. There is some coordination of reflexes which improves now. Then secondary circulation reactions 4 to 8 months. The infants perceive, maintain interesting experiences. Okay, new response patterns are coordinated intentionally. Then coordination of secondary actions 8 to 12 months. There is beginning of search of vanished object. Okay, so this is the first sign of object permanence which is attained, and this is a reason why the child can play peekaboo during this stage 8 to 12 months. Okay, so object permanence starts to appear. Then comes this tertiary circulation 12 to 18 months. It then comes the invention of new means through mental combinations. Okay, they imagine certain events and outcomes. They can play with a Lego. They can form, use symbolic representations. They show reasoning. They attain object permanence by the age of 2 years. Then comes the second stage of Piaget, pre-operational stage, 2 to 7 years. Okay, the three important terms to understand here are egocentrism, centration, and animism. Animism, I just explained, is simply finding life in inanimate objects like furniture, wall, etc. That is there. Egocentrism is there. Egocentrism means what? This experiment was conducted by Piaget, in which a doll was placed on one side of the table and on the other side the child was made to sit. And now you can see that these are three different mountains of three different sizes. If you ask the child during this age that which mountain is the doll able to see first, the doll's perspective, the child will say the largest mountain, because that is the one which the child is able to see. Okay, so this is called egocentrism. They can't see or they can't feel other people's perspectives during this age. Then comes the concept of centration. Centration is, like in this example you can see, this experiment was conducted where a child was made to sit with two identical glasses in front of him filled with equal amount of water. Now in front of the child, the same water was poured into a larger thin cylindrical beaker which was of more height than the glass, and the child was asked which has more water. So the child pointed that the one which is taller, or the one which has a taller height, has more water. Okay, this is the concept of centration. They can't focus on different aspects of mass, volume, size, so his impression is guided only by the taller height of the glass. Okay, so there is faulty reasoning during this stage about cause effect relationships. So this is called centration. Okay, this is further subdivided this stage into preconceptual, which is 2 to 4 years, and perceptual or intuitive, which is 4 to 7 years. So this is a rapid development of language takes place, symbolic play, and they use classes inequality. They might call all the men daddy. That is one example. Then perceptual or intuitive substage, reasoning appears but remains centered on appearances and confuses reality and fantasy, and tends to center on most noticeable aspects of things, like they fail to conserve identities in terms of volume, number, and mass. Okay, so the flexible mental actions are yet to develop. Dental application is constructivism, cognitive equilibrium, animism. Child likes to explore things, make own observations. So we have to keep the visit exploratory, initial visit. Then child is explained about the instruments. In simple words, you can explain the procedures, allowed to deal with things, and use of alternate words, that is euphemisms for the equipments, should be done. Decentration is the ability to concentrate on more than one aspect of the problem. So when various distraction techniques are used, the child learns to focus on other interesting and curious aspects in the environment and forgets about the dental treatment. This is the reason we keep the dental operatory very colorful and child friendly, so that the child is unable to concentrate on the treatment and is concentrate his concentration is mainly on the surroundings, on the beautiful different colors or things which are there in the operatory. Okay. Then comes the concrete operational stage, which is 7 to 11 years, and here systematic reasoning now appears. Thought processes, logical, reversible, they are developing. So alternate strategies are invented. Okay, comprehends conservation of number, mass, and other properties, develops reversibility, and the child is able to decenter now. So these are certain terminologies again. Seriation, it is the ability to sort objects in order to according to size, shape. Then transitivity is the ability to recognize the logical relationship among elements in a serial order. Like if we tell the child A is taller than B and B is taller than C, then the child will be able to recognize, and then A must be taller than C. Classification, the ability to name and identify a set of objects. Decentering, the child takes into account multiple aspects of a problem to solve it. Reversibility is the child understands that numbers and objects, they can be changed, and they can be returned to their original state. That is the idea of reversibility. That also starts to occur, and there is elimination of egocentrism now. So the child's ability to see things according to others' perspective begins during this stage. Okay. Dental application, they can be given concrete instructions now, like we can give them clear instructions. This is a retainer, this is a brush, you're supposed to use your brush like this. They are also allowed to hold the mirror to see what procedure is being done on their teeth. Okay, so they get involved in the treatment now. They can hold the suction tip for themselves. Then comes the formal operational stage, which is 11 years onwards. The reasoning from hypothetical propositions can take place. Okay, so now they have the ability to deal with the abstract concepts. Abstract reasoning develops. Okay, they can think about theories, and if you hypothesize anything, they'll understand during this stage. The dental application is aesthetic and corrective dental treatment can be done during this stage. It's the best time to do that. So just to summarize these stages: infancy 0 to 1.5 years on an average, oral phase, okay, according to Freud. Then Eric Erickson's basic trust versus mistrust, the sensorimotor stage. The characteristic behaviors during this stage are limited vocabulary. Pre-cooperative stage, there's fear of falling or sudden movement, unexpected jerky, quick jerky movement. There's fear of bright lights. Separation anxiety exists. So during the dental treatment, we have to be careful to Introduce the child carefully to the dental office. Dentist must be confident and experienced. Dental chair should never be lowered or tilted suddenly without telling the child. Bright light should not be used much. Okay, and the child is usually treated in the mother's lap. Then the early childhood, 1.5 to 3 years, anal phase, autonomy versus shame and doubt, preconceptual stage. Okay, so here up to 2.5, it's the same thing which we have to follow. And then 3 years, after that, they can communicate. They have a great desire to talk. They concentrate on the movements of the dentist. They tend to do things which they are not told to, and separation anxiety still exists. So they require an introductory visit to the dental office, and they're able to sit still for around 10 to 20 minutes, understand simple clear instructions and explanations for tell show do. You can praise the child's abilities now. Non-verbal communication like a smile or a positive expression, pat on the shoulder, all those things can be done now. Speak positively, and now the child has some control over the situation, and parents may remain in the operatory as an observer. 3 to 5 years, phallic stage, initiative versus guilt. During this, listen to the verbal directions. They have lively minds, they are great talkers. Separation anxiety to some extent might exist. There is still fear of bodily injury or prick of the needle. They are worried about, they have the fear of needle injury or the sight of blood. Okay, so animism, egocentrism, centrations, these things exist. During the dental visit, they are able to concentrate for a period of 30 minutes now, which is more than they understand the instructions, and you can praise the child's abilities. Non-verbal communication, parents may remain near. You can give positive reinforcements now. Then comes the early school age, 5 to 12 years, latency or industry versus inferiority or formal operational stage. Okay, so according to Freud, it is latent stage. According to Erikson, industry versus inferiority, and according to Piaget, formal operation stage. They are ready to accept the community experiences, little to no fear of separation, proud of their positions. Egocentrism is still there, but after 8 to 12 years, they understand the procedure. There is a desire to be obedient and tolerate the procedures to some extent. Okay, so you can give them a realistic view of the treatment, explain the procedure in simple terms. You can reassure them. Okay, then comes adolescence, which is 12 and above. This is genital stage according to Freud, and then Erickson's identity versus role confusion, then concrete operational stage. So here two important terms are imaginary audience and personal fable. So children during this stage feel that they are being watched, so people are watching them. That is the concept of imaginary audience. And personal fable is that they are their favorite, they like themselves. So dental visit, you have to see the motivation. Usually it comes from the peer influence. So now I'll discuss few questions, two, three questions. So in managing a 7-year-old patient, the dentist should keep in mind that the child at this age, A, is frequently negative, B, susceptible to praise, C, generally uncooperative, or D, prone to sensation anxiety. So 7 years, always remember, just now we summarized that during this stage the child is susceptible to praise. If you praise them, or social praise or social reinforcement work well during this stage. Okay, like for example, if you are going to extract the child's uh, tooth, then in that case you have to, after the successful treatment, if the child behaves well or any kind of procedure, dental procedure, then you should always, for the appropriate behavior, can give them a positive reinforcement. They are susceptible to praise during this age. Then the other question is whistle. It is a euphemism for explaining the following instruments in children. So euphemisms are nothing but word substitutes. Okay, so for different, so the options are high speed handpiece, suction apparatus, low speed handpiece, or air syringe. The whistle is referred to as high speed handpiece is referred to as vessel in euphemism. Low speed handpiece is also known as motorcycle, and suction apparatus is usually referred to as a vacuum cleaner. Then air syringe is usually referred to as wind gun or air gun. So like that, there's a whole table where all the euphemisms are given. You should learn that. Okay, then information of a tooth to be extracted in a child 6 to 8 years old should be given to the child in preceding appointment after planning extraction. Never given to the child as it may hurt them. It is given to the child immediately before the procedure or is given to the parents and not to the child. Okay, so information of a tooth to be extracted in a child who's 6 to 8 years old. Now the child can understand the procedure if you explain the child in simple terms. Okay, so it should always be given to the child. Never deceive a child. Okay, tell them in a prior appointment that your tooth is carious, or you can tell that the tooth is sick and we need to fix it, we need to take it out so that doesn't cause any hurt or harm to you. So this should be given to the child in the preceding appointment so that the child is mentally prepared in the next appointment that extraction will occur. Then the child who's younger, 4 to 7 years, in them you can inform them prior to the extraction. But in children who are 6 to 8 years old, they take it well if you explain in simple terms. So it has to be given to the child in the preceding appointment after planning extraction. Okay, so that's all. Thank you so much for your attention. In the next section, I'll be covering the social learning theories. Okay.